So you've had a C-section, and now you're thinking about your next baby. You've probably got a huge question on your mind. What are my options this time around? Well, today, we're going to break down something called Vbac, which stands for vaginal birth after a cesarean.
Right. So you've been through a C-section, and now you're wondering, can I have a vaginal birth next time? Is that even safe? These are absolutely the right questions to be asking. And in this explainer, we're going to dig into the medical research to help you get a handle on all the key factors.
Okay, first things first, let's just make sure we're all on the same page with the lingo. Vbac. It stands for vaginal birth after cesarean. You know, for a long time, the thinking was once a C-section, always a C-section. But things have really changed. Medical practice has evolved, and now Vbac is seen as a totally safe option for a lot of women. Now, it's not a sure thing, right? It's an attempt. That's why you'll sometimes hear doctors call it a trial of labor after cesarean, or TOLAC for short.
So, the big question is, how do you and your doctor figure out if you're a good candidate for this? Well, the research points to a few really key factors that can totally boost your chances of a successful Vbac. Let's dive in and see what they are.
Okay, so the research really zeroes in on three main things that predict success. First up, and we're going to talk more about this one in a sec, is if you've had a vaginal birth before. Second is if your labor just starts all on its own, spontaneously. That's a great sign your body's ready. And third, studies have found that having a body mass index, or BMI, under 30 also points towards a good outcome.
But out of those three, man, the evidence is just crystal clear on one of them. The number one absolute best indicator for a successful Vbac is having had a successful vaginal birth in the past. And here's the cool part. It doesn't matter if that vaginal birth was before your C-section, or even if you've already had a successful Vbac after one. It's a huge green flag either way. So, let's paint a picture here. Imagine a mom whose first baby was born by C-section, but for her second, she had a successful Vbac. Awesome. Now she's pregnant with her third, and that successful Vbac she already had, that is the single strongest sign that she can do it again. It's like her body has already proven, hey, I've got this.
All right, but of course we've got to talk about the risks, right? It's super important to have the full picture. So let's switch gears a bit and take a really honest, factual look at the biggest concern when you're attempting a Vbac.
Okay, so the main risk, the thing your medical team is keeping a really close eye on, is something called uterine rupture. Now that sounds scary, I know. It's when the scar from your old C-section tears during labor. But here's the key thing, it is super rare. We're talking a risk of less than 1%. Still, it's serious, and that's exactly why a Vbac is always done in a hospital where everything can be managed carefully.
Okay, so that naturally leads to a really important question, right? How would anyone even know if this is happening? What are the actual warning signs that doctors and midwives are trying to spot?
Your care team is basically on high alert for a few key things. They're glued to that baby's heart rate monitor. It's called a CTG, looking for any sign of distress. They're also going to be listening to you. If you have any really bad abdominal pain that just doesn't feel like a normal contraction. Other big red flags, if the baby's heart rate gets super fast and stays that way. That's called tachycardia, or any kind of unexpected bleeding.
Now, all of those signs matter, for sure, but the one that is most common, the most reliable signal, is a change in the baby's heart rate. Any sign of fetal distress that shows up on that CTG monitor is often the very first clue that something might be up. Honestly, that monitor is probably the single most important tool in the room.
Okay, so knowing the warning signs is half the battle. But what happens if one of them actually shows up? This is where the medical safety plan comes in. It's a super clear, pre-planned protocol for exactly what to do in that situation. And that emergency plan is designed to be two things, direct and fast. There's no waiting around. No, let's see. The second the team spots a real warning sign, the call is made. It's time for an emergency C-section. It's a quick, two-step response, and it's all about making sure both mom and baby are safe, period.
Okay, here's a practical question I hear a lot. What if your labor kind of stalls out and you need a little bit of help to get the baby out? Does having a C-section scar mean that things like a vacuum delivery are a no-go? Well, the medical guidance on this is pretty clear. Most of the time, no. Having a previous C-section doesn't automatically rule out a vacuum-assisted delivery as long as your doctor thinks it's a safe and needed choice for you.
Whew. Okay, that was a lot of information, I know. So let's boil it all down. let's talk about the key takeaways, the stuff you'll want to have in your back pocket for your next chat with your doctor or midwife.
All right, let's do a quick recap. We learned the #1 success factor is having had a previous vaginal birth. The key risk that everyone is watching for is uterine rupture. The top warning sign for that is fetal distress showing up on the monitor. And the safety plan, if that happens, an immediate emergency C-section. Boom, 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 boom. Those 4 points, that's really the heart of any conversation about VBAC.
And just remember, the whole point of this isn't to tell you what choice to make. Not at all. It's to arm you with solid information, the foundational knowledge, so that you can walk into your doctor's office and have a really good, really informed conversation about what's best for you, for your body, and for your family.
So, I'm going to leave you with a question to chew on. With all this information in your head now, what's the #1 most important question you're going to ask your provider when you talk about your options?